94.3 WYBC, the rhythm of the city. I'm Darryl Huckaby with DD in the morning on a Feel Good Friday. And today we're going to continue to keep you connected to what's happening in the community. We have a special guest joining us to talk about something that is really relevant as we head into the winter season, and that's vaccinations and protecting yourself against the flu. There's COVID still out there, as well as RSV. And joining us this morning is Maritza Bond. She's the Director of Public Health for the City of New Haven. Good morning, Maritza. Welcome back.
Good morning. Good morning. It's such a pleasure to be with you again.
Yeah, always good to have you join us and share information that our listeners need to know in order to protect themselves and stay healthy. So as we're heading into this winter season once again, flu, as I said, COVID-19, RSVP have been, probably top conversation for a lot of people, and being vaccinated against that. So what should we do? What should we look for as we head into this holiday season?
We are now going from gathering together outdoors to having to gather indoors because of the cold weather. This morning I was freezing with the rain, and some towns had snow and some slush. And so hopefully everyone got into work safely. But most importantly, 'tis the season for dealing with the different viruses that can pose a threat to certain communities. We know that young children and adults over 65 and individuals dealing with immunocompromised situations and pregnant women are at highest risk. And so we're here doing a campaign on making sure that we remind people that as you are preparing for this holiday season, it's great to gather together, but we want to make sure that people have access to vaccines and stay healthy and safe.
Okay. And what vaccines are out there? I know a lot of people think COVID, although we're not in a pandemic anymore, you don't really hear as much about COVID as we used to, but it's still out there, just like the flu and RSV. What vaccines are available now for those that need to get vaccinated? Because I know there's been a variety of updates in terms of vaccinations.
Yeah, absolutely. There's a flu. So we all know COVID-19 is no longer a pandemic, but it is lumped into respiratory illnesses as a whole. And so there's flu vaccines, RSV, and COVID-19 vaccines. Specifically, we want to make sure that in the health department in New Haven, we have flu and COVID-19 vaccines available for our residents. And we want to make sure that individuals are protecting themselves. I mean, we know that pharmacies also offer vaccines, individuals, private physicians, but we know that there's a certain community members that are underinsured or not insured. And we want to make sure that people have access to low cost or even free vaccines at the health department, so that is not a barrier to staying healthy.
So you don't need insurance necessarily if you go through the Department of Public Health through New Haven.
Right. If you're uninsured or not insured, we offer a we charge a small nominal fee, or if that someone is not able to afford that, we will vaccinate for free to make sure that people are staying safe.
Oh, good. And where are the locations for those vaccinations?
So we are out in the community literally everywhere in the last 2 months. And so we want to make sure that people visit nhvhealth.org/vaccines to know where we're going to be. But we are also at the health department at our new location. We're actually approaching our 1-year anniversary of relocating, and we're at 424 Chapel Street in the city of New Haven. And so we are here to serve our people, because we know that just this season alone, as of today, we've already seen 4 deaths of individual from flu and 175 deaths due to COVID-19 in the state of Connecticut. So we want to make sure that no additional lives are lost. And so we want to get the message out there.
Okay. And again, if you're just joining us, we're talking to Maritza Bond. She's the Director of Public Health for the City of New Haven. Now, for those people that may be a little hesitant or wary about vaccines and getting vaccinated, what would you say to them to encourage them?
It's important to, number one, self-assess. I just described the communities that are at most greatest risk, which is young children, individuals like our grandmothers and great-grandmothers, and pregnant women who we are going to be gathering with during the holidays. And so while we may be healthy, those around us may not be healthy. And so just being mindful and responsible of when you are demonstrating any type of symptoms, for example, not being around individuals making sure that you wear a mask if you're going to be at a gathering, but really stay home if you're sick. It's important that you know that the risk factors that you can pose on somebody else when you think that you yourself are healthy. And so it is important that you also are informed. And so we have information on our website that individuals can retrieve to be informed, and also ask your providers on what the best choice is for you. It is an informed decision that you have to make, but we know that it can save a life, and so the risk outweigh the benefit. And so it's important that people really make the decision on protecting who they love, and most importantly, protecting yourself.
And the community. It's a collective.
The community at large is essential.
Right. Absolutely. Now, everybody knows about the flu. It's been around for a long time. COVID, obviously, everybody knows about. RSV is not a new virus, but it's becoming more prevalent, and we're hearing more about it. Can you talk about RSV and what that is?
Yeah, and RSV is predominantly impacting certainly the infants and the elderly. So it's important that individuals consult with their providers. But it is another virus that presents just like the symptoms of COVID and flu. And a lot of these viruses do display similar symptoms. So it is important that individuals know when they are symptomatic and know when to consult with the provider on what the best choice is. But we know that even if you get COVID, you can get vaccinated for the flu, for example. So we know that if you get COVID, and some people are getting COVID, my son just unfortunately had COVID right before the holidays on Thanksgiving. And we wanted to make sure that now he has antivirals that are going to protect him for a few months, but I still encourage him to get the vaccine for flu. So one can impact the other, even if you if you were symptomatic for one of them. So we do encourage individuals to get informed about which vaccine would best work. And, people like our Dr. White, who works for the Board of Ed and as an assistant superintendent, got vaccinated a few months ago with us, and he decided to get vaccinated for flu and COVID together. We know that RSV is specific vaccine that should be for anyone over 6 months and over that can get a one-time vaccine. So again, it is up to the individual to know which one is best for you and making that informed decision.
Right. And again, we're talking to Maritza Bond, Director of Public Health for the City of New Haven. I just got my flu. Well, I got my flu a couple of weeks ago, and I got the COVID and RSV. So I'm leading by example, and I want everybody to follow us. Now, finally, when we seem like we're getting sick, you're catching something. Nowadays, because of the three that we just talked about, it's kind of hard to determine, which one it is. What's the order of process or progress that you should go through? If you feel like you're getting sick, whether it's the flu or COVID or RSV.
Individuals, obviously, there's still COVID test kits available for individuals. We are still disseminating them. The federal government was disseminating them for free as well. And then RSV, you certainly need to go to your provider. So it's important that you get access to a provider to get tested. And flu-like symptoms are very similar, right? And so going to the doctors, knowing when to go to the doctors, making sure you take the over-the-counter medication, staying hydrated, all of those things are important. And I think one of the things about our New Haven residents that I'm so proud of is that we were leading in the state of Connecticut. We were very wise, and we worked together as a community in staying safe. And so knowing what those symptoms are, knowing when to wear a mask, knowing when to just consistently washing your hands, being mindful of traveling because the air filtration may not be the best when you are also symptomatic. So just being mindful of those things that we've already learned, right? And so that is critical. We are also going to be on December 23rd, going to be at Hill House from 1 to 5, making vaccines available. And then Friday, December 27th, we're going to be at Career High School from 9 to 1. And so we want to thank our schools for just opening their doors and allowing us to be part of providing vaccines at the community for people to have access.
It's a collaborative effort. That's good. Awesome. Now, if you are feeling like something is coming on, finally, just, you should kind of stay away from people. Don't, if you feel like you're getting sick, you don't want to be around other people, and that, just be mindful of your personal feeling, not physical feelings, and then, try to stay away from people so that if you do have something that
Right.
is contagious, that you're not spreading it through the community.
Right. And we say stay at home and away from others for at least 24 hours after your symptoms, and making sure that you're getting better, right? And are
Right.
fever free. And so those are what the recommendations are. And some employers may say stay home until you're completely symptomatic free, right? So you also want to just adhere to your employer's policies. But it is important that during that next 5 days that people are taking those necessary precautions by wearing a mask so that they don't expose others.
Okay. Awesome. And give the website again for people that want more info.
Right. nhvhealth.org /vaccines.
Awesome. Maritza Bond, Director of Public Health, City of New Haven. Thanks for joining us again. We're going to have you back. We love having you on to disseminate the information to help keep our community safe and healthy.
Thank
So
you.
thanks for joining us.
It was such a pleasure, and happy holidays to all of you. Stay safe.
Happy holidays to you as well. I'm Darryl Huckaby with DD in the morning on the Rhythm of the City, 94.3 WYBC.